bringing together voices in child and youth healthcare. This is CAFC Presents.
CAFC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, McMaster Children's Hospital Foundation, the Children's Hospital of Eastern Ontario Research Institute, the Children's Hospital Foundation of Manitoba, the Montreal Children's Hospital Foundation, the Holland Bloorview Children's Rehabilitation Hospital Foundation, the Children's Hospital Foundation of Saskatchewan, and Trillium Health Partners. We would also like to thank the following Keystone and program partners for their ongoing contributions that support all of CAFC's programs and activities. If you have any questions or comments for our panelists, please type them into the question box at any time during the presentation. You can also share your thoughts and questions on Twitter by tagging @CAFCTweets and using the hashtag CAFCPresents. All of our webinars are recorded and can be found on the CAFC Knowledge Exchange Network. Use the CAN to share these recordings with your colleagues or register an account and post comments, links, or other resources that you think will be of interest. And be sure to sign up for the CAFC Presents weekly email newsletter to stay up to date with upcoming webinars and our recorded webinar archive.
Hello, everyone. Welcome to today's episode of CAFC Presents. I'm Doug Maynard, the Associate Director at CAFC, the Canadian Association of Pediatric Health Centres. And today we're going to invite you to join the conversation. And that conversation is going to be about building a national toolkit to support parents of medically complex children and youth. And it's my pleasure to welcome some of our colleagues and partners from the Children's Hospital of Eastern Ontario and the Ottawa Children's Treatment Centre to the presentation today. Today we're going to be talking about resources for parents of children with medically complex needs, and hopefully some of you were with us back in October in Montreal at the CAFC annual conference, where we were able to launch, along with our partners at CHEO CTC, the hashtag MyComplexLife, the hashtag itself, as well as a YouTube video that we were lucky enough to partner with CHEO CTC on, that was really designed to start to tell the stories of families of these children with medically complex needs. This area of these medically complex children has been an area of interest for CAFC for many years. We have had our community of practice on medically complex children for over 5 years now, led by Lisa Stromquist and Dr. Natalie Major, also from CHEO, and preparing some guidelines, which will be released in the next few weeks, and maybe actually just after Christmas. We should see some guidelines around what organizations can do to support and to organize services around medically complex children. So lots of activity in that area that's of great interest to our community. We do encourage you to today, as we mentioned, we do tweet throughout the webinar. If you do want to tweet, please don't hesitate to include the hashtag MyComplexLife hashtag in your tweets, and please do go check out the video. We'll put a link to the MyComplexLife video in the chat box as well, just something else that you can hopefully take a look at yourself and share as broadly as you possibly can. So it's now my pleasure to introduce the team from CHEO CTC, from the Navigator Program there. We have two parent navigators. We have Teresa MacMillan, who has a teenage daughter who has been followed by multiple specialists at the CHEO CTC team, and Lillian Kitcher, who has an 8-year-old, also being seen by many specialists at CHEO CTC. And both of them will be offering peer-to-peer support to families in the program, as well as hosting events and workshops. And joining them, we have Brianna Gibbon, who's the System Navigator Lead, and Brianna plays a leadership role in implementing the Navigator model, working in partnership with community organizations and parents to assess the needs and gaps and to establish best practices and build community capacity to ensure families are well supported. And also, last but not least, we have Melanie Perron, who's the System Navigator and Social Worker for the Navigator Program, and she has experience offering counseling support to vulnerable populations within the nonprofit sector, the private sector, and in the hospital setting. So as the title of the session suggested, we do want to hear from you. We do have the question box, as we mentioned in the opening. That is your opportunity to both ask questions, and we're going to be asking you some questions and inviting you to share some of your thoughts around what we can do to support parents of medically complex children. So please don't hesitate to post your comments at any point during the presentation, and I will help bring your voice to our panelists so we can hear from you, because we really do want to hear from you and have you join the conversation. So without any further ado, it's my pleasure to hand the virtual podium over to the team at CHEO CTC. Over to you.
Thank you, Doug. we're very pleased to have everybody join us today. So just a little bit about how we're going to unroll this. I'm going to talk a little bit about the Navigator program briefly, just because that's where this initiative grew from, and also speak to what some of the major challenges are for parents that we've collected through our efforts, and talk a little bit about how we collected this information. And then we're also going to ask you guys to join in on the conversation, hence the title of the webinar, because we really want to hear from you about what has been working or what your efforts have been to kind of support parents and families in these areas. So as Doug mentioned, we'll have some reflective questions for you after each section that we go through. So we encourage you to take the time to kind of type some of those out, and we can answer as we go, but also if there's not enough time to kind of get to them during the presentation, we can also open it up at the end to really have a dialogue, because that's our goal today. So the Navigator program is a 5-year federally funded program through Employment and Social Development Canada, and it was created to address a critical gap in supports for parents of children with medical complexities. So in addition to supporting parents one-on-one in accessing and navigating support services for themselves, we also have the mandate to kind of increase the understanding of best ways to support parents, and that's really by identifying what some of these gaps are. So that's where we are today. Our efforts to date have led us to have a certain level of understanding, and we'd like to open up the conversation on how we can how we can best address these gaps. So to date, we've served around 85 families in the Ottawa-Outaouais region since 2016. And in working with these families, we've identified some of the major challenges. We'll go more in depth as we go, but just to give you these are the top 6 that we work with continuously with families. So there's some stats on here about our working with local families. For instance, 69% of the parents we work with have financial concerns directly related to caring for their child. 37% also spend between $5,000 to $20,000 extra a year on equipment and child support. And 29% sought out program support for the reason of isolation. So as I said, we'll go a little bit further into this, but just wanted to give you a little bit of a snapshot. In the invite to the webinar, there's some supporting documents attached with an extended version of this information that we'll reference a little bit later. So how did we collect our information? So we've held a series of engagement sessions with families, starting, really the first one was, do we have an understanding about what some of these challenges are? What are we missing? What's your experience in trying to navigate these challenges? The second one was really, we had a group of parents who were particularly interested because they had success in navigating some of the systems, and seeking their input on their experience and their successes in kind of navigating. And the third was really a focus on idea and solution generation on how to address some of those. So those were in person, but we've also had group communication with families that we work with, Navigator Program and Complex Care, just asking if what we're capturing resonates, to get a deeper understanding about what some of the prominent challenges are, and then actually the feedback for the document itself. In addition to a call out to families to participate in the documentary that Doug referenced, to kind of highlight what some of those challenges are in a different true story. So it's quite powerful for those who haven't seen it yet. I encourage you to check it out. So in addition to consultation, there's also the one-on-one support that we do daily with our families or with our parents. So they provide us information to be able to have an understanding of how to better support them, and some of that information is used to populate this document. So, why are they seeking out support? For what reason? What areas? Some of the demographic and profile information that comes through when we do our psychosocial assessment at each intake, and then also capturing what the related social determinant of health is for each intervention with the family. So this works really well because not all families are able to participate, via email or focus groups. So this is really how we did outreach to those families who were a bit harder to reach and their voice maybe wasn't as prominent as others. So, and then also partner consultation. So there's a social work community of practice that is with CHEO, now CHEO OCTC are one, but CHEO social workers, OCTC, Rogers House, and then also through the complex care advisory. So you can see the various partners there. So really getting feedback from our partners' perspective as well, whether or not, some of the things we're capturing actually resonated. So as we move forward, we're going to share what some of those findings are. So again, if you could refer to that, the inventory of gaps and barriers. We're going to ask you as we highlight what some of those are, if you could reflect what you've seen or what you're doing or what you know of that would work best to support parents in that area or in general. And then we're going to offer some of our successes or learnings to date. And again, this document was collected, the major challenges was collected at a local level, so we tried our best to kind of generalize it so that it'd be applicable at a national level, but feel free, it's still a living document, so there'll be a call out at the end if you do have any additional information that you'd like to see on there that you'd be able to contribute to that as well. So, and again, our purpose, this is the first of many conversations on, building a best practice on how to support parents who have children with medical complexities. That is our end goal, and we would like you guys to join the conversation and help contribute to that. So, Doug, I don't see any, I don't have my conversation window open. Are there any questions, or are we okay to move forward?
Yeah, we did have one comment came in early from Ashley, who said she's a parent, and this is the first time she's hearing about this Navigator program, although she is in the York region. She'd love to access the program, but she says her son has intestinal failure and has been chronically ill since birth. He's now 8, so she thinks this is an amazing program so far.
Wonderful. Thank you, Ashley.
So would you like us to, are you ready for us to play the video now?
Yeah, I think so. If you want to start off with that, that'd be great.
Sure.
Great. Thanks for sharing that, Doug, or for getting that up. So we wanted to open up the conversation with that because I think that as a team, one of our biggest, not learnings, but one of the things that we found most important is the framework in which we work with our parents and families is really important, and acknowledging that the value in having parents identify what's important to them, where they are, and meeting them with where they're ready to address. So, in terms of empowering decisions and increasing the likelihood of success in actually being able to achieve some of the goals that are set out. And I think that is something that we would like to share with others. And it's a little comedic in that video, but we completed our first year evaluation with 38 of our participants. And at that point in time, 71.4% indicated that their therapeutic goals had been achieved in working with the program. So I think there's something to say, in the approach in working with parents. So moving forward, we're going to reference the document now, and I'm going to hand it over to Melanie, who's my colleague, and she's the social worker for the program.
So one of the major challenges identified for parents of children with medical complexities is their personal health, and that includes both emotional and physical aspects. As you may already know, parents experience grief, anxiety, depression, and post-traumatic stress disorder related to their providing care for their child with medical complexities. They're frequently exposed to triggers that bring back memories of trauma related to past medical interventions, medical decline, and care needs for their child as well. And in caring for their children 24 hours a day, 7 days a week, parents experience exhaustion because they are required to be hypervigilant with their children and are often sleep deprived. Most support services that are, support services are very difficult for them to access for reasons that are unique to this population. And so parents are also experiencing chronic health issues as a result of being in a caregiver role for 24 hours a day and experiencing very high levels of stress. And so, some of these challenges as well in terms of accessing services include, for example, difficulty accessing respite services or finding workers that they can trust. And so at this point, I'd like to invite you to reflect on this question. So is that something that resonates with you? And maybe what have you done to support the well-being of families in that regard? Some of the learnings that we've experienced and support that we offer through the program includes individual counseling using a strength-based approach, as well as a therapeutic support group that is really geared towards the needs identified by the families and also focuses on trauma and chronic stress related to caring for a child with complex medical needs. We are also using a narrative approach called the Tree of Life and exploring self-care and mindfulness through that group. And using that narrative approach is also proven to be not re-traumatizing for parents. And we're also going to share that with you in our toolkit when it does come out.
Hi, I'm Teresa, one of the parent navigators, and I just wanted to add to what Melanie said about parents experiencing chronic health issues. My daughter is 16 now, and I find over the years it's getting harder and harder with my own health from being sleep deprived for so long and the stress, and I find now it's really starting to catch up with me. So it's a very real issue for our families.
Lovely. Okay, so pass it on to Teresa.
So I'm going to talk about isolation for our families. So the isolation of a parent of a medically complex child is very sneaky. We become so hyper-focused on our children and their needs that time goes by, and when we finally have a chance to look up and catch our breath, our friends have moved on with their lives. Our families are so focused on, day by day. Sometimes we take things minute by minute. Sometimes we save our children's lives every single day. So it's hard to relate to our friends who have typical children, healthy children, and so the isolation catches up to you. And especially for our families during winter season, I met this mom and she said no one comes in her house if they have to be 7 days symptom free before they come into their house. And so for the 4 months in the winter, we shut down. No one comes in and no one goes out. And it's old because it's to keep our children healthy and it's to keep our children alive. Sometimes support groups are often diagnosis-based, and families with medically complex children are often without a diagnosis or have multiple diagnoses, or sometimes they even are on the more severe end of the spectrum of a certain diagnosis, and sometimes that's even hard to fit in and to find your tribe and to find your people who get it. And that's so important for our families, because you need to be able to talk to somebody who understands, and you need to be able to just talk to people who get it. So I don't know if anyone has any questions about what they have seen that works to support parents. Some of the things that we've done is that we do a monthly sip and chat where myself and Lillian are there, and we host it in a coffee shop in the city. And parents are invited to come, and we just chat and we just talk, and sometimes we swear and sometimes we laugh and sometimes we cry. And it's all about being there for other people and to increase our circle of support and increase the people who you have to speak to. We also go out and meet our families. I'm going out for lunch today with one of my moms. We go out for coffee. Sometimes we just chat. Sometimes we email just to check in with our families. We also do a family fun day in the summer where all of our families get together and we have entertainment, we have prizes, we have crafts for the children, and it's such a great time for families to connect with each other.
I think I'm just going to add on to that, Teresa. I think that it's, it takes a lot of effort to create the container to have conversations with others or get together with others. And I know that Teresa and Lillian have, as a designated paid peer support position, are able to take that, the onus of setting the plans, finding the location, doing all of that effort, and just really having families come and connect with each other. And it's lovely to see how many families have met online previously or have connected, through social media, but not in person yet. And I know that as a part of the program was it was a proud moment to see that we were able to connect families who weren't otherwise connecting. So,
can I add one more thing to that? Last night I was talking to two moms, and they hadn't met each other before. It was through a group, and they were talking about having a play date with their children. And I just thought it was so wonderful because they'd never met each other before, and the one mom was saying she was so isolated and she just wanted to get out and meet other people, and we have these two families who we connected, and they're going to have a play date. And that, it sounds small, but to those families and to those children, it's huge.
A few comments come in from the audience. A lot of people agreeing with that, particularly a number of comments came in around the social isolation and how it sneaks up on you. And there was a couple of interesting perspectives on that, in that the one person said they never thought that having a sick child would force friends and family members away. But other people commenting that it sometimes goes the other way, and the families withdrawing themselves away, as opposed to other people not wanting to interact with them. They're withdrawing themselves away for the various reasons that you said, that you indicated. A comment came in when you talked about the sip and chat sessions and getting together with these families, and how that's a great idea, and the opportunity to share stories and maybe learn things from each other, and even to just be listened to by people who can sort of relate to your story or to your situation in a meaningful way. The question was, though, that sometimes those kinds of groups of people who share a same tragedy or a same trauma or what have you, the conversation becomes heavy and constantly focused on the negative aspects of whatever the situation might happen to be. Do you have to make an effort, or does the conversation naturally sort of translate to other topics that may be more, uplifting, et cetera, that are not always focused on the child? Or do you find you have to control the conversation in that way to prevent that? Or do you have any kind of structure to these kinds of sip and chat sort of meetings?
No, we don't really have a structure. I think humor is one of our greatest strengths for most of our families. We can laugh at things. All of our families tend to bring that in, and so sometimes they are heavy and sometimes they are sad, but then there's so many times when they're wonderful too. Like, we have families who share, something. I had a friend, her daughter was 9 and had never sat up before, and she finally sat up at the age of 9, and there was so much rejoicing for this mom, and so I think, and to be able to have that with other parents who understand just how great that is and how amazing that is, I think it redirects itself, if that makes any sense. And we did have some training around peer and grief support, the parents, the parent navigators we did. And we also did some training in motivational interviewing too. And so that helps us to kind of direct conversations if we feel we need to. But we try not to, because these parents are bringing to the table whatever they need to talk about. So sometimes it is heavy and sometimes it is sad, but it can also be funny and happy and rejoiceful.
Francine made a comment. She says she's a parent of a complex kiddo, and she understands the goal is to improve, of this session of this program, is to improve the lives of families like us, she puts in quotes. But she's wondering how you are looking to assess the program, and maybe this is something that you're going to get to at the end of the presentation, later in the presentation, so please feel free to hold off if any of this kind of information is coming. But just wondering how, understanding it's difficult with these kinds of programs to really measure whether it's working. Do you have any intent or any have you looked at a way to assess whether this program is making a difference and how you could measure that?
Yeah, I can. This is Brianna, and I can speak a little bit to that. I think some of this stuff, we're compiling the tools and as well as the knowledge that we're learning, and will be available in this best practice toolkit. But a big significant part of our team isn't with us today, and that is we have a research coordinator and a research assistant who are working closely with us to ensure that we are assessing and evaluating the impact that this program is having. So, I think it may be a conversation for another time, or we would be able to share it once our toolkit becomes available, but we are definitely measuring everything that we are doing. So I hope that's...
So that's all we have for comments for now. If you wanted to move on with a few more segments of your presentation here.
Perfect. I'm going to jump into financial. This is a big one, and I think it touches everything. And the reality is that parents do incur a significant out-of-pocket expenses, to be able to support their child. And so that's on equipment, therapies, transportation, special diet, respite. And those are things that you would, aren't surprising when you think of the context, but then, there's also the cost of parking at the hospital. There's the cost of gas to and from various appointments and visits. The cost of food when you are admitted. The other thing as well is parents are responsible for navigating the web of, we put complex web of federal, provincial, and municipal supports in order to receive this support. And often they are siloed. They're not communicating. So the amount of the multiple applications and then the various reporting mechanisms back, and then the onerous amount of time to collect information in a certain way that can meet the expectations of the various funding streams. So, one of our parents is talking about, in an ideal world, they'd have a personal accountant that would kind of take off some of that, the onus on them in keeping track of this really sophisticated reporting system. So at one point in time, we tried to put together a kind of map so that parents could understand what funding came from where, what fell underneath it, what was covered, so that it was kind of easier to have an understanding. And as you can see by looking at this, it's clear as mud. So, yeah. And I think the other thing as well is that families who earn over, the number fluctuates per year and the amount of children, but over approximately $65,000 a year don't qualify for any financial assistance specific to their child's medical needs. And that doesn't matter how many children are in the family, or how many are being supported on that salary. There's a little consideration for that. So, yeah. So again, we can move forward to the next one, which is going to be respite, but asking people to reflect on that, and our call out to join the conversation is really to share what you guys are doing that is working, or that or that you felt confident that has supported parents better in any of these areas. So I'm going to pass it off to Lillian, and she's going to talk a little bit about respite.
Thanks, Brianna. So I'm going to talk a bit about the barriers our families have with respite. As many of you know, the idea of respite is a great idea in theory, but for our families, many of the times they have a very difficult time finding proper care. It could be because trying to find a respite worker to train, sometimes they don't have the skills that we're looking for. So even when we do find somebody that we train, the pay is not very high. So then they end up leaving because they'll find something else somewhere else. That's another issue. Another issue is that we have a respite worker data bank here in Ottawa. I'm not sure if they might have something in other areas as well, but the data bank is not specific to children that have, it's not specific to families that have children that are medically complex. So sometimes we're not finding the kind of workers that we need. And then another problem too has been the fact that you can get a PSW, but PSWs are not well trained in the sense of dealing with children that are medically complex. So some of the PSWs are actually not comfortable working with our families. So for that reason, again, we're left with not finding somebody who can help us. Another issue that we've had is that parents have difficulties trusting someone to provide consistent care for them. And a lot of out-of-home respite centers don't provide one-on-one care, and many of our children need one-on-one care, and we're not able to get that from out-of-home respite centers. And we also don't have a lot of out-of-home respite centers in Ottawa, which is also another issue for our families. One of the things that we have done here is we've partnered up with Andrew Fleck to provide short-term childcare for our families. So they pay a small fee, and Andrew Fleck will send them a care provider who will help in the house with the child that's medically complex and the other siblings as well, if families wish. And this will give families a chance to rest or go out to the gym, do some shopping if they choose. So that's one way that we're trying to help families in this area. Is there any other things that you guys want to add to this?
Nothing from our end. Anything on your end, Doug, or should we move on to daycare or childcare?
Yeah, a number of comments. The whole issue of the financial strain is certainly well recognized out in the audience. Unfortunately, no suggestions on how to resolve that one. A couple of comments about the respite care and wondering about, a couple of people made similar comments around, that they know their child best and they're more than happy to take care of the child. And is there any opportunity to have support for the other activities of life that infringe on their ability to take care of their child, like the daily activities of living for a parent, like laundry, cleaning, et cetera, et cetera? Is there anything in the way of respite care that can help support those activities while the parent is parenting their child?
That's a really good idea. Well, but even with, you could use your funding, your personal funding with SSAH or Enhanced Respite, but you're still going to have to hire somebody to provide that service whilst you're taking care of your child.
Yeah.
And we hear that a lot, as we move on. There's one of the categories or one of the areas is, recognizing the impact on the family, and how often we hear that it would be lovely to just be able to be a parent as opposed to having to be in a caregiver role all the time. So that's something that we acknowledge as well, and we hear echoed quite frequently. So whoever highlighted that, thank you. We've noted it. Okay.
And just before you move on, a comment just came in that says she's indicating she uses SSAH funding to pay someone to clean their house while she's caring for the child. So there's someone who's doing exactly that. Yeah.
Yeah, there's some creativity around those funds. They're not, unfortunately, it's not a lot of money, but, you know, for any home, you know, shoveling the walkway, cleaning the house, doing, you know, doing some of those daily living activities. There's some wiggle room for support there, but it is limited. So, okay. Daycare.
Thanks, Brianna. So this is Dawn. There are many challenges identified in regards to child care, and some of these include the fact that daycares are reluctant to accept a medically complex child because they become responsible for initiating requests for additional support, such as enhanced staffing and training to accommodate that child. And so it really becomes the onus is really on the daycare to report back then to, let's say, integration services or hire more staff. And that is usually very challenging, or we see that that's challenging for parents to see that. And then when they are daycare subsidy freeze, there's no funding available for additional support and training to obtain enhanced support. So when this happens, children with medical complexities cannot attend daycare at all. And also, existing programs specific to medically complex children do not operate at full-time hours. And this, you know, prevents the primary caregiver from either participating in full-time employment or education. Parents are also unable to afford daycare for any of their children because of the high cost of caring for a child with medical complexities. And then, so usually you will see a lot of parents staying at home with their children as a result. Did you have anything to add, Teresa or Lillian?
Sure. Okay, it's Teresa. I'm going to talk about school. And this is a hot button topic for me because my daughter's 16, so there's so many issues around school. It's vast. But I'm going to start with the nursing support in school. When my daughter was in grade 3, we couldn't find a nurse to attend school with her. And so I had to go to school with her for 3 months, acting as her nurse, because they just couldn't find someone who was experienced and reliable to meet her needs. So then I had my other daughter. I had to put her into daycare because I was a stay-at-home mom. And then I had to pay out of pocket for that care for her. And it was just so that goes into financial burden as well. And then we eventually found a fantastic nurse who we loved, but she had health issues and would be off for up to a week at a time sometimes. So then again, I was going to school with my daughter and had to put my other child in care. And one time we had a nurse, I was at my friend's house, and her son was in the same grade as my daughter. They were in grade 2. And my friend's son said to me, he said, Teresa, can you tell Abby's nurse to stop snoring in class because it's interrupting my work? And I was like, oh, my. So we quickly got rid of her. But then again, I was left going to school with my daughter. And it's such a huge thing. And sometimes those families, that's the only break we get was when our children are at school. And we know that they have good care and that they're safe. Also to do with school, oh my goodness, I could go on and on. Just the expectations that the school has sometimes for our children and our families. One time Abby was in the hospital and she was sick and I was making her do her homework. And she said, Mommy, what are we doing? And I said, I have no clue. And it was just because the school was putting so much pressure on me because she misses a lot of school. I think she's 16 now, and I would think she's probably missed 1.5 to 2 years of school, her entire school career. And so I always feel the pressure for her to keep up. So it's just immense. There's way too many issues to talk about. But if anybody has any suggestions, we'd love to hear them.
I just wanted to add in regards to school as well. I think one of the big issues, too, is the fact that on the PD days, the nurses are not able to travel, are not able to go into school. And I know for me personally, when I was back in school studying, we had a snowstorm and it was a PD day, and my son could not go to school. So I missed a lot of school myself personally because I had to stay home, to the point where my professor said to me, you may have to drop out of the course. But it was just because I could not get any care for my child. Even though the school is open, there is no nursing service, which is a big issue for families that do have work or do have school. What do we do when we can't provide that nursing care for our kids? So definitely, if there is some answers or a way we can deal with that, that would be great.
So I'm conscious of the time, and I'd love to really have a little bit of dialogue going on. So that was, we took over, we addressed the big chunk of the document, or started to, on the agenda was also recreation, employment, housing, family, transportation. I'd encourage you guys to look, to review the document, and I know that Doug and his team will facilitate a way for us to continue the conversation after, maybe by sharing contact information. I guess one more thing to share before we open it up is that Teresa and Lillian have been doing a Day in the Life awareness campaign throughout the hospital. So it initiated as a way to kind of help sensitize hospital staff by sharing what their day might be like before they arrive to the hospital. So Complex Care Kids Ontario came and did a session with a lot of the complex care families and came up with this infographic about their experience, and our campaign really is based on sharing that, and it's proven to be an effective way to kind of help sensitize staff and ask them to reflect on what they can do personally or departmentally, to change their practice or to make a small improvement in order to better support parents or families of the complex care kiddos. So I guess I'm going to open it up now to see, Doug, if there was any other comments or feedback or input or questions that came through. Again, our hope today is this is the first of the conversations to kind of follow off our campaign at the CAFC conference last month, just hearing what other people are doing with the end goal of compiling this best practice toolkit on supporting families. So not only do we want to hear what you've seen that works, but also maybe reflecting on, is there anything that was missed in the inventory? And then also for the toolkit, do you guys want to contribute in terms of successes or highlighting successes to date? What's the best way for us to collect some of this information from you moving forward? Even what would be, if you had this toolkit, what would be the best way that you would most easily access it? So I guess if I could open it up to you guys, I'd love to hear, the team would love to hear from you.
So that's your cue for the audience. If you do have anything, any way you would want to contribute, how you would like to contribute, any suggestions that you have, please do type them in. If you do have any sort of larger comments that you'd like to share in this regard about how to help us build this toolkit, if you do, there is a raise your hand button. We don't typically do this on our webinars, but if you did want to raise your hand with that button, we would be willing to unmute you and let you speak if you have something that's, because some of you might have good ideas that are a bit long to be typing in. So if you do want to raise your hand and make a comment or provide a suggestion or share your thoughts, please do that and we'll unmute you. Make sure you do have a working microphone on your computer, or if you're using the telephone, that should be fine. But we did have a few comments came in for the daycare and the school sessions that really seemed to spark some nerves out in the audience. People really experiencing some frustration there. People calling it discrimination, that children are not allowed to attend public daycare, schools, etc., or that are having these kinds of challenges, just as you've described. A lot of people suggest, a couple of people identifying homeschooling was their only option, recognizing that it's not ideal, but it seems to be the only thing that works. One person saying that the schools just didn't get it, in quotes. So yeah, definitely lots of frustration with schools and with the daycare situation. We did have a question about the toolkit itself and when it might be available. Do you have any timelines as to when you hope to launch something?
Yeah, we have a goal in mind that we're working towards this time next year, to pulling this all together and having something. And I think, again, as well with the inventory of gaps and challenges, I think that we'll aim to have something ready at this time next year, but recognizing that it's a fluid deliverable that is always open to feedback or input as we grow and learn. So, but our goal is a year, this time next year.
All right, so lots of time to provide some input.
Lots of time, yeah. So I'm not sure, in the absence of any questions, I appreciate everybody's comments and thoughts to date. I think, as I said, this is the first of many conversations. So this is usually typically sent to everybody who participated. They have access to the PowerPoint. Is that what? I'm just wondering the best way to facilitate communication after, but for my contact information or.
Yeah, so, and speaking of, we had Gabby who's with the California Children's Services is interested in getting in touch with you guys. She's a social worker and manages medical care for children with medically complex conditions. So they're looking to partner with other agencies. So I will certainly share the contact information with you that she's shared with us.
Yeah.
But so the session is being recorded. We do post these recordings on the Knowledge Exchange Network. The PowerPoint slides will be posted there, and we can put your contact information there. I know you still have the My Complex Life form is up on the join the conversations, or there's a forum where you can provide feedback there. We can put a link to that on the Knowledge Exchange Network there. Everyone attending the session today will get an automatic notification on Friday with a link to that page. It's the same page that you would have clicked through to register on. It'll just take you back there to see all these resources once they are available on Friday, or they're often available before that. But the notification will go out on Friday. If anyone else has any questions, if you don't get to that page, if you weren't the one, if you're listening but you were not the one who registered for the webinar, that's the only person that will get the email. You can always email us at CAFC, and we'd be happy to pass them along to our colleagues at CHEO.
Perfect. Maybe if, I'm just looking at the time and we still have about 10 minutes, maybe if we want to play that second video and give people time in case there's any last questions, they can collect some thoughts while we're watching that one.
Sounds good. That was another great video, just really identifying some of the issues around the challenges of working with families and really understanding what it is they're going through. So that was a fantastic video. We did another comment from Stephanie at Sick Kids. They're also interested in, they're actually in the process of building a new education program to build capacity within the community for healthcare providers for children with complex medical needs. So certainly interested in looking to connect. So again, we'll share that information on as well.
Thank you, Doug and Stephanie. Any last closing words on your end, Doug, or we're?
Yeah, so I think we're pretty much out of time. So why don't I just pass that question right back to you? If as we're closing this session, what would you maybe identify as maybe the next step, or a resource that someone should check out, or any closing key messages that you can think of that you'd want to leave the audience with as we close off?
Yeah. Well, as you mentioned, there's quite a few ways to connect with us. Our campaign, My Complex Life, we have our website up on the CHEO website, as well as the Navigator Program. They both fall underneath there. There's some interactive questions on there where you can connect directly with us to share some of your thoughts. I know that my information will be shared as well as the information from today. And I think that we encourage and welcome and invite everybody, to connect so that we can do something collaborative. We also have, for those who are local, we've worked hard to develop a local inventory of resources that's housed on the CAN. So for any of those who are Ottawa and region, that would be relevant for you. You can also look at that. And then I think that I'm going to pass it on to social worker Melanie because she just had a few closing comments as well.
Well, I think we're all really glad that these challenges, resonated with you from the comments that were shared. And also in regards to, interacting with families, it's to keep in mind, the trauma-informed care model that is being used here and can be, there's lots of training available on trauma right now. So that is one thing that can be implemented in regards to, getting staff trained and things like that. And yeah, that's pretty much what I wanted to add.
Anything, Teresa, Lillian, anything from the team? We're good?
Thank you. I think we're good. Thank you for listening, everyone.
Perfect.
Just before we sign off, so thank you for that. I mean, great presentation, and thank you for the contributions from everyone from your team. We did have an interesting comment from Lori, who's from Manitoba, who also wants to stay engaged and connected with this work. She says in Manitoba they've developed a common intake referral process for families who are trying to access school, daycare, and respite providers to ensure the medical training is available to those who are caring for the child when they're not in the care of their parents. So again, I know Manitoba has done a lot of work on trying to coordinate across ministerial barriers across health, education, social services, etc. So perhaps some examples to look out to there. So again, she's also wants to share her information with you as you continue on with this work.
Wonderful. That sounds impressive.
Yeah.
Yeah.
All right. So I think with that, we'll wrap it up. So thanks again to our team from CHEO OCTC. Great work, and CAFC's been a part of to play a small part in some of the pieces of it. And we look forward to the toolkit when it's available and to helping along the way. We do our webinars every Wednesday at 11, and when you can join us live, you do get to participate in the discussion, which is always great. And when you can't, as we mentioned, we do record the sessions and make them available after the fact on the Knowledge Exchange Network, and you will get that notification in a couple of days when that becomes available. Next week, on December 12th, we will once again be welcoming a different team from CHEO OCTC, but this time to talk about their Newcomer Navigator tool, which is a toolkit, which is a program that was created as a result of the Syrian refugee initiative that entailed the resettling of 2,000 newcomers to Ottawa, and a significant chunk of those that were resettled were children. And the CHEO was faced with supporting a high volume of refugee children with complex needs. So based on that experience, they created the Newcomer Navigator Toolkit that was launched as a website called simplifyingthejourney.ca, all one word, simplifyingthejourney.ca, to help Canadian organizations start their own Newcomer Navigator program. So again, along the theme of navigators, this time focused on supporting refugee children through the healthcare and other systems as they to help improve their health and well-being. So a great presentation next week. Please don't miss that one. There's obviously lots of time to sign up. So and that will be the last one before we break for Christmas. Unbelievably, it's almost that time of year. So thanks again for coming this week. Hopefully we'll see you back next week. Bye, everyone.